everyone, my name is Ainsley Broadwell and I am a summer intern here at Lyles Parker. Thank you for joining us for this new webinar series with Home Care Association of Louisiana. To get us started today, we have Dr. Warren Hebert. Dr. Warren Hebert, RN, made his first home health nursing visit in 1985 and has been CEO of the Home Care Association of Louisiana since 1998. An assistant professor of nursing for 4 years at Loyola School of Nursing in New Orleans. Warren is now adjunct at Rutgers University for Institute of Health and Healthcare Policy and Aging Research. Dr. Hebert is on the expert panel of aging of the American Academy of Nursing.
Thank you, Ainsley, and welcome, listeners. We're very excited about this partnership with Lyles Parker. It gives all of you an opportunity to get some of the top-notch expertise from a legal perspective across a really broad range of different topics. So we're excited to have not only Louisiana agencies with us today, but other Lyles Parker clients from across the country. I certainly don't want to go any farther without saying that we are pretty excited about LSU's victory in the College World Series last night. If we got any Florida folks listening in, we'll touch base later. But we're very excited. The issues that we deal with around ADRs, prepayment reviews, post-payment audits, and suspensions, the impact of these administrative enforcement tools on home health and hospice certainly is a hot topic, and we're excited to have Meaghan McCormick and Christin Thompson with Lyles Parker with us today. Thanks very much, and again, we appreciate the partnership.
Thank you, Dr. Hebert. Today's webinar is titled ADRs, Prepayment Reviews, Post-Payment Audits, and Suspensions, the impact of these administrative enforcement tools on home health and hospice agencies. Our presenters for today are Meaghan McCormick and Christin Thompson. Meaghan is a senior associate at Lyles Parker and is a certified professional coder. She has also had experience working for a home health agency before attending law school. Meaghan has experience with auditing claims, identifying deficiencies, and assisting clients in improving their documentation. Meaghan also has extensive experience working on compliance plans and developing policies and procedures for a variety of different medical providers. Christin Thompson is an associate at Lyles Parker. Before joining Lyles Parker, she worked as a professional coder, assigning diagnosis and procedural codes for urgent care, inpatient and outpatient facilities. She has experience identifying documentation deficiencies and auditing claims for a variety of practice types. Christin assists providers nationwide with developing and implementing policies to improve documentation and coding practices. Quick reminder, if you have any questions throughout the presentation, please feel free to type them in the chat box and we will address as many as we can at the end of the presentation. Without any further ado, I present your speakers, Meaghan McCormick and Christin Thompson.
Thank you. If you could go ahead to the next slide. Just a quick disclaimer, this is general information only. Your situation may vary based on the facts and circumstances, and please reach out to counsel to discuss anything before relying on any of the specific information, but we'll be talking in general and just going over some general things here. If you can go to the next slide. Okay, the first thing we're going to discuss are TPE audits. Those had been on pause for a bit during COVID, but they are back in force and starting to be given out. Some of you may have received one recently. This is just a little bit of background. They started, in 2014, and they've kind of changed throughout the years of what they can do. TPEs can be either a prepayment or post-payment audit, and they can involve the MACs focusing on a specific providers or suppliers or that bill a particular item or service. That's just the background there. You can go on to the next slide. Okay, the MAC, so your Medicare Administrative Contractor, Their job includes reviewing treatment documentation to cut down on improper payments. The TPE process, which is targeted, probe, and educate, will be run by the MAC, and they will select providers for their documentation to be reviewed based on a number of different indicators. It could be your billing patterns, it could be improper payment rates. There's many different reasons why you may be selected for the TPE process, but once you are selected, the standard process would be that you'd have 20 to 40 claims that are picked either per provider or per item or service, and then you would have those audited and then receive corresponding education for any denials that you receive. There are some circumstances where those numbers of claims can be different, but it is expected that you would fall within the 20 to 40 claim range. The TPE process is 3 different rounds. You will be discontinued from the process whenever you become compliant. How that is determined and the percentages that determine compliance are vary based on the MAC. They set their own rules. Some are publicly stated, some have changed, but whenever you are deemed to be compliant, you can be removed from the TPE process. If, however, you go through the 3rd round and continue to fail, then you would be referred to CMS for further action. You can go on to the next slide. When MACs are selecting who to audit, they typically look for outliers. This is normally done through data mining, but they will look for things like a high volume of services, high cost per service, if you have a dramatic change in frequency of use, if you had a big change year over year, either up or down, any change or difference that makes you stand out from other providers within your area, all can affect whether or not you're selected for the TPE process. It can also be referred to them to go through the TPE process. And MACs tend to target providers with historically high claim denial rates or with billing practices that vary from their peers. Anything that really suggests that you might be a risk to the Medicare Trust Fund. The referrals that they get for auditing can come from any of the other contractors or OIG, CMS, to then get in and look at a provider in a more detailed way. You can go on to the next slide. If you are selected for the TPE process, you'll receive a letter that tells you that you are being targeted for review. That letter will lay out the whole TPE process, what you can expect. They also discuss the one-on-one education that you're entitled to as part of this process, and that the MACs have the option to refer providers to a RAC or UPIC as a result of non-response to ADRs. So then you'll receive an ADR. If you're selected for the TPE process, they select the 20 to 40 claims, you receive ADRs for each of those. Those are additional document requests. And ADRs will be discussed later as well, but how the TPE process works, you receive your 20 to 40 ADRs. They will be separate, normally, documents. The ADR letters, they're sent until the identified number of claims are sampled. And typically, your first round of TPE will start by selecting claims based on your claim submission date. So within a range of dates, they will select their 20 to 40 claims. After that, your subsequent rounds are selected based on date of service. And this is because they're allowing you time to implement the education. If they based it on your claim submission date, you could have had older claims that were prior to the education, and when you had a chance to update your practices, and it would not be then showing them that you'd actually made strides to improve your documentation. Therefore, it's based on date of service after the first round. There's some notification language that has to be included, and it tells you, but what's important here is the second bullet point at the bottom under the notification letter, and it discusses the fact that CMS has the authority to revoke a currently enrolled provider's Medicare billing privileges if CMS determines that the provider has a pattern or practice of submitting claims that fail to meet Medicare requirements. So if you have a high error rate they have the ability to revoke you. We're not going to go into too much detail here about revocation, but suspension does come up in revocation if you have a high error rate. So it is something to be aware of, that there are very real consequences to these auditing processes and failure to provide the correct and necessary documentation. Things that are likely to get you to the point of suspension or revocation are patterns or practices of noncompliance. So they'll be looking at repetitive errors. And it's another reason why it's so important that you keep up with your compliance practices and that you have a compliance plan that is actually being enforced to ensure that you do not reach the standards and don't get those types of results. Okay, you can go on to the next slide. So when you get a ADR for the TPE audit, you should gather and submit your records just like any other type of audit. It's really important that you go through though and that you check your documentation and make sure that it is complete and accurate, that every requirement has been outlined and that you make sure that you have all the documentation. Make sure also that you're reviewing the letter carefully. Sometimes they are asking for additional records that you might not expect. It could be that they're requesting 2 or 3 episodes of care for home health or hospice prior to the actual date under review. These requirements or what they're requesting can vary. Your MAC might have some sort of documentation on their website that has a checklist or a Q&A related to TPE, and that might further lay out what they're looking for and what helps them review the claims, and you should definitely take a look at that to see if you receive a TPE audit. And it's very important that you make sure you submit your documentation by the due date listed in your ADR letter. As we noted, there's 20 to 40 episodes or 20 to 40 claims that will likely be reviewed in this process. Each of those ADRs can have different due dates. So it's very important that you are tracking these and following up to make sure that they are all being submitted and provided on time. If you fail to respond to a request for documentation, it can result in a referral to a RAC, ZPIC, UPIC. And any of these audits can be result in extrapolated damages or other outcomes that will be discussed later as well. But the point is making sure that you get when you get the audit, you are reviewing those claims and providing complete documentation to try to pass this audit as quickly as possible. You can go on to the next slide. So when you submit your documentation, the MAC will do a medical review. That will review any errors with your documentation. Some of these errors can be easily resolved. For instance, if you have an issue with a signature. Now, that's a little bit different for home health. I mean, signatures for a note can be added via signature attestation, but for instance, if your 45 wasn't signed, there isn't an update that you can do for a signature attestation necessarily for a unsigned 45. But if a note is missing a signature, or if things that aren't orders from a doctor are missing a signature, then you can typically supplement those with some sort of signature attestation. Also, if that is your issue, of course, it's easier to check and resolve on an ongoing basis for future audits. Also, you know, if you fail to provide certain types of documentation, those can be added with a supplement, or if the claims have already been denied, it can be added on appeal. But just keep in mind that the appeals do not help you necessarily while going through the TPE process, as the appeals do not have to be considered as reducing your error rate, even if you win those appeals. That's obvious for a number of reasons, specifically that the auditing process can take months, and you will have already moved on to the next round of TPE before you get a chance to resolve those. Now, if it was just failure to provide one document, you submit it on appeal, and it gets in on time, there is a chance that you can, that those might be considered, but that is up to the MAC and not a guarantee. And I believe Christin was mentioning earlier that she's aware of one TPE process that's been put on hold for the results of an audit. Christin, if you want to.
Right. So we have one provider recently who is going through the TPE process, and their MAC has actually said they will not start the second round until they have received their appeal, which is unusual, and it would be interesting to see if that is going to be a trend that continues. Of course, that would be in the provider's favor, allowing them to reduce those TPE error rates.
Absolutely, and a chance to maybe get out of the TPE process at an earlier round based on winning these on appeal. But that's not something that you should expect. It's not the standard, and so but it is something to keep in mind that, you know, if you get your audits and your appeals in quickly, it might slow down the process, but we can't guarantee anything with that. Typically, you can expect that when you send in your documentation, if it's a prepayment review, you'll get results within 30 days, about 60 days for a post-payment review. Sometimes these are slowed down or sped up, but those tend to be pretty close on track for when we get results back for a medical review. The TPE reviews are supposed to be conducted by registered nurses, certified coders, physical therapists, or other appropriate or relevant licensed personnel. That does not mean that you're likely to get a result that, you know, makes sense, but they are supposed to have qualifications before reviewing the medical records. But oftentimes what you'll find with the results is it's kind of a bean counting experience. They have a checklist and they're looking to see, do you have these things and do they meet the requirements? So it's not just based on common sense or, you know, arguments that, you know, the care was necessary or good or helped the beneficiary. It's about whether or not you meet all of the documentation requirements. You can go on to the next page. Okay, so we've kind of gone over this a little bit here, but this is an outline of how the TPE process works. You first get a letter telling you that you've been selected for the TPE process. Then you get your 20 to 40 claims, request for records. You go through the medical review. If those claims are denied, you then get invited, or if any of your claims are denied, you get invited to a one-on-one education session. It's very important that you complete this education session. Some providers decline it thinking that they know the rules or that they just won't benefit from it, but it is very important that no matter what your denials are, that you agree to the education session and then that you take advantage of that education session. When you're there, you're allowed to ask questions. You're speaking directly to the reviewers, the people who will be reviewing your claims throughout this process, and this is your chance to really see how the MAC interprets some of these rules. As you can know, there can be some disagreement about what requirements state, and hearing what the MAC believes really just hammers home what you need to do, because regardless of what the law states or what the regulations state, it's important that you're abiding by what the MAC is actually considering the process and what they're going to enforce, so that way you can meet those requirements and pass through this process, because obviously the goal is to get your claims approved. So you do the education, and then you're given at least a 45-day period to make changes and improve. That sometimes is extended. It can be some more time. I have clients that have had up to a year between TPE rounds, and they kind of thought that they'd been forgotten about, but they weren't. It just took about a year, and then the new letter started coming out. Especially when you have more time, there really isn't an excuse for why you haven't implemented the education, but don't count on having more time. Take those 45 days after you get the education and get these changes implemented as soon as possible to get your claims approved. After you go through the 45-day waiting period, you get 20 to 40 more claims selected. That goes through the whole process again. You go the second round, same thing, you get education, you get 45 days, and then you would go into a third round. As long as you keep getting denied. At any point, you can be removed, though, for compliance. And if after the third round you are found not to be compliant, then you will be referred out for other CMS actions. But if you're found to be compliant, you would not be reviewed again for at least 1 year on the selected topic. Now, you can have multiple different types of TPE going on at the same time that focus on either different services, different providers, And that does not mean that you won't get audited either by a UPIC or anyone else as well. It just means that that one specific issue of whatever they were looking at for this round of TPE would not be audited again through the TPE process for 1 year. All right, you can go on to the next slide. This is the flow chart that also kind of goes off of what we were just discussing. And it shows how if you make it through, when you get out of the TPE, or when you go on for possible further action. Round 3, you really do not want to get to. If you fail round 1, it happens, you know, you get a chance to get education, you get a chance to update your documentation, and your goal should be absolutely to pass round 2 if you can't pass round 1. But you really do not want to get to round 3, because the risk of failing round 3 and the risk of being sent on for further action, which could be a UPIC audit, it could be a suspension, a revocation, are significantly higher risk areas and can really result in some of the worst possible outcomes. And so it's very important that you pass the TPE process at least by round 2. But if you do get into round 3, then you take that chance to very much make sure that everything you're submitting is compliant, and hopefully you will pass at that point. All right, you can go on to the next slide. So throughout the TPE process, we found a number of the most common denial reasons that are listed here. For home health and hospice, missing face-to-face documentation is one of the most common reasons for denial. Still to this day, the face-to-face requirements have been out for a number of years now. They have changed a couple of times, but it's been pretty standard now for a while that you need to get the actual physical notes from the provider who did the face-to-face with the patient. But that is still being found to be an area of concern, and many providers are failing this on review. Some issues with the face-to-face, besides just not being collected, are issues with it not being performed by the certifying physician. Of course, another type of physician can perform it when it's in an acute care, but there are rules about what needs to be in documentation from the certifying physician as well in having reviewed those notes. And many times those additional rules get overlooked. In addition, the certifying physician has to state the date that the face-to-face occurred. Oftentimes, providers are now having a box on the 485 that states the date of the face-to-face encounter, but in many examples, that box is left blank, and they're not adding in the date of the face-to-face encounter and when it occurred. And that is a requirement and a very, very common reason for denial that we are seeing now. Or if the face-to-face was not related to the primary reason for home health. There's just a number of issues with the face-to-face encounter that providers are still having issues with. So it's very important that you understand what the requirements are and that you're conducting internal audits and reviews to make sure that you are meeting those. In addition, missing or incomplete initial certification or recertifications, the signature of the certifying physician not being included, encounter notes that do not support all elements of eligibility, documentation that does not meet medical necessity, and records not submitted. Records not being submitted is a very, very common error that we see, and that is just failing to either submit the entire record or part of a record. Sometimes providers don't review closely enough and submit the wrong records, and those would be considered records not submitted. So just making sure that you're aware of all of your deadlines and the documentation requirements, and making sure that those documents are actually submitted is very important. You can go on to the next slide. The education, so after you go through the review, you get a chance to get education. This is one-on-one with the auditor, and it's very important, as I stated already. These can be done as a teleconference call, an electronic visit. It's also important to note that if you call the MAC, sometimes they will do like an informal discussion with you, And during that time, they consider that to be your education. So making sure that if you're calling your MAC and talking with them, that it's very clear what is considered your one-on-one education, because you don't want to miss a chance to actually get the full education and a detailed chance to answer your questions and have whoever you want to participate with you, to be on that call. Because I've seen it where clients of mine have called in and they had a quick 10-minute call with the auditor. They were trying to clarify something, and then the auditor considered that their education. You obviously would want to push back if they do that, to make sure that you get a chance to really go over everything that was said. And again, do not decline your chance to have the education. You can go on to the next slide. As discussed, the education should be individualized, it should be claim specific, and conducted in a format that is interactive. So you get a chance to ask questions and speak with them. You can have anyone you want on the call with you, anyone who can benefit. So you could have your biller, you could have different providers, nurses, whoever you want to hear the education can participate in to get the training. And you get a chance to ask all of your questions. If you are told something is denied for a reason and you're not familiar with that regulation or rule, you can ask them for where it is located, and they will provide you with the CMS policies, laws, or regulations that apply to that item or service, and where that support for that is, so that we can take a look at it to better understand. And there's the information about the individual claims. You can ask questions about the actual claims involved in the audits. So you can use real life facts and things like that, so that way you make sure you understand what they're saying and why that claim was denied to fix for the next round. You can go on to the next slide. After the education, you'll get a results letter. It says the results of claims denied with your specific errors. You should be given your error rate and how to appeal any denied claims. And then you have specific deadlines for when you need to respond to these. And it's important to note that deadlines can be different for to avoid recoupment than what the actual deadline is for just the appeal to stay live. But just keep in mind that recoupment deadlines can be different, and that you want to appeal any denied claims that you feel were wrongly decided. You can go on to the next slide. You can be referred out to CMS at the MAC's discretion after 3 rounds of TPE. You can also be referred to the UPIC at any time. And during the TP process, they don't have to wait for you to complete the 3 rounds. So if you submit or in the first round and something is very concerning to them, or for whatever reason they believe that this is a larger issue, they can choose right then at round 1 to send you to the UPIC, and at that point you could receive a larger audit. It could be an extrapolated audit. It just depends from there what steps they take. And they will document if you referred or refuse to receive any education if you are referred out. And that is noted and discussed. So keep in mind that a refusal for education can result in negative inferences about your agency. And you can go on to the next slide. If you have a sufficiently low error rate, you can be removed from TPE after any of the rounds. After you've done out of the TPE process, the MACs continue to use data analysis to monitor you. So this will check to see if you greatly change your practices or anything else as either a result of the education, or if you just waited until the TPE process ended and then just went back to your previous billings. They will notice that. And that continue up to a full year after the TPE process. And as noted, while you won't be audited typically on the same information that was just completed during that process that you passed during the year, if something is concerning, then you might get another audit or referred out. There's different ways they can determine your error rate. It can be from the dollars denied versus the dollars that would have been reimbursed if the claim was paid. It can be based on the specific number of claims that have been reviewed, so 10 out of 40 claims, or some kind of mixture between these two. Your MACs will determine how they determine your exact denial rate. And then they also determine what the denial rate means. The MACs set their rules for how to get out of the TPE process. They set their own rates for what they consider to be a sufficiently low error rate. So keep in mind that that can vary by jurisdiction. You can go on to the next slide. Here are some examples of at least what they used to state was their error rate thresholds. These can have changed, but this is the last cases we've worked on have reported these error rates for the TPE process. So for example, Palmetto there has a 20% error threshold. So if you fall below that, then you would be removed out of the TPE process. But if you're 21%, you would continue through. You can go to the next slide. So here's some compliance tips for TPE audits. You should find your MAC's TPE webpage. Then you can review the different checklists or education that they have on there that tells you how to get through the TPE process and what to be included. It's very important that you make sure that your point of contact is correct and up to date in PICOS. They will use that to contact you, and you can miss either education or documentation if that is not correct. As always, you should be conducting internal audits and reviews, but specifically before you submit your documentation to the TPE, you should be reviewing all the documents to make sure that they are accurate and up to date, and that there's no missing documentation or supplements that are needed. You need to respond within the notice letter's time frame, so don't miss any deadlines. Create a spreadsheet if you need to make sure that you're tracking and know when each of the ADRs are due, and just realize that not every ADR will have the same deadline, so making sure you're paying attention to that. You need to receive the education that is offered, make sure that you're participating, and that everyone who would benefit from it is given the results of that education, so that way they can update any practices that are needed, because especially with home health and hospice, you oftentimes need to get all of your providers involved in understanding what they need to do in order to be compliant and making sure that they're all educated on what their expectations will be. If you need to make any changes to your policies or procedures based on the education, go ahead and do that and disseminate that to your staff. You can go on to the next slide. So ADRs, which are kind of part of the TPE process because you do receive additional document requests, are separate though from TPE in the fact that a straight just ADR is less risk than the TPE audit because it's typically one claim, one service that's being reviewed only. There's few initial questions. However, the TPE process, there's a lot more risk because they're looking at 20 to 40 claims. There's a lot of questions that can be raised and about your documentation process because they were looking at a larger number of claims. It's important to note that you can be in multiple TPE probes at the same time. You can also receive multiple ADRs at the same time, different services or multiple NPIs. So just keep in mind that there's a lot of different audits that can be ongoing at the same time. You go on to the next slide. And Christin is going to come over and take over talking about the ADRs.
Thanks, Megan. The additional documentation requests are part of Medicare's overall medical review program. The authority can be found in various sections of the Social Security Act, like sections 1883E and 1815A, which are here. The most important thing to understand is that a MAC has the authority to review any claims at any time. Something to remember too is that in being a Medicare participating provider, the cost of doing business is that you're going to get audited. It's not a matter of if you're going to get audited, it's a matter of when and whether you're ready when the time comes. Next slide. ADRs are done prior to payment of a claim and are usually handled by the MAC although some can come from other contractors. There are various reasons that providers receive ADRs. An element of a claim might mean a prepayment edit. It could be a national edit. There could be a specific national review program that's being focused on for a specific ICD-10 code. We're seeing a lot of these program-focused ADRs right now. It could also be a provider-specific edit based on reasons or edits developed by the MAC's internal medical review or program integrity unit. All prepayment edits can key on beneficiary Medicare numbers, the provider's NPI, a specific service date, CPT or HCPCS code, maybe an ICD-10 code. There are a variety of reasons. Next slide. So you're going to receive a letter notifying you, and it's going to be sent to the address on file in PICOS. You need to make sure that that is current. A physician who has left the practice or the agency will receive that. It's going to be mailed to the agency on file. And you're only going to have 30 days to respond and submit the documentation. So if your address isn't current, then you can run into issues where you're not able to file things timely. Palmetto states documentation received after 30 days might not be processed before day 45, and if you fail to respond within 40 days, the claim can automatically be denied. The timeline's important because one of the major denial reasons related to ADRs is that documentation isn't received. It's hard to believe that a provider wouldn't respond to an ADR that they do receive. I'm not sure if quick timelines are the problem, and that's getting the documentation together and submitted. It's really important to be aware of those deadlines like Meaghan was discussing with the TPEs and making sure you're getting the documentations in time. You can always supplement, which is important as long as you make sure that you put your ADR cover letter on those supplements and make sure it's fairly clear to the contractor that you're submitting to that these are in fact supplements. Next slide. So this is just a quick little visual of submitting the ADR. You're going to send each ADR packet separately. The ADR cover letter should always be included and put on the top of your records. It can be helpful to submit the documentation through the electronic portal. It will get there instantly. The processing times are faster. You get results faster, and then you get paid faster. To the extent your claim is determined to be payable. I am old-fashioned. I send everything by mail, but again, it's your preference on whether you use the electronic portal or mail in your responses. But always keep a copy of your records. Many providers don't do that, and then they get a denial. They bring us on board, and we ask what was submitted to the MAC. Unfortunately, the provider doesn't know. A lot of times they'll offer to re-pull it from the EMR, but we don't know if that's exactly what was sent to the MAC. We don't know what the MAC is looking at. So it's really, really important to keep a copy of those records on file that you've submitted in response to an ADR. If the MAC overlooks something, we can say we have a copy of the records, we have the page numbers, we can point them to a specific spot. If you're missing a certification, you say, it's on page 4. The physician signature is there, for example. And that's a quick way to correct a wrong in the review and help you get an easy win. Be sure to pick up the phone and call the MAC for questions. They do have a provider education department and provider resource line, so it's always worth asking, particularly if you've identified a mistake and it's something that's easily correctable. Next slide. What's the difference between receiving an ADR and being placed on prepayment review? ADRs are typically initiated by a provider's MAC, and they typically relate to a particular probe or edit conducted by the MAC. They can be focused on specific services, lengths of stay, a provider or specific diagnosis. In contrast to an ADR, being placed on prepayment review is going to affect usually 100% of your claim, and it can last for up to a year or more. It's an intensive process. It's rarely less than 100%. All of your claims are going to go through the review, and that can affect the revenue stream for a provider. Next slide. For prepayment reviews, UPICs will typically send notice to the provider if they're selected for review. However, we've seen quite a number of providers who've never gotten notice and just started receiving requests for documentations, which can be alarming. There is a provision in the Medicare Program Integrity Manual that says they should provide notice. You can push back and make sure you get that documentation if you have not received it before you start receiving requests for documentation. Private payers are increasingly placing providers on prepayment review, and unlike Medicare and other governmental payers, very few private payer contracts go into much detail when it comes to how the provider may be placed on prepayment review. They also typically don't address the scope of a prepayment review, so it could be very uncharted territory to get into a prepayment review with a private contractor. From a practical standpoint, the payments can be delayed up to 6 months or longer. So we want to make sure that where possible, we don't jeopardize that revenue stream. Next slide. With any audit, our advice is always the same. Never ignore the problem. Review the claims and associated documentation before you send them in. These are many of the things that we've pointed out before. Make sure medical necessity is substantiated. Make sure the sort of services are documented. Make sure the documentation complies with local coverage determinations or national coverage determinations. If they don't, if there are missing elements, go to the provider to prepare an addendum in line with the Medicare record-keeping principles. We want to make sure that we fill in those gaps whenever possible. Clearly marking these things as an addendum, not altering the original documentation, making sure they're signed off with the date that the addendum or correction is made, are crucial to making sure that these things are accepted. If your providers are doing all of that, they are able to make the addendums to their documentation to clarify, to correct, or to elaborate. It's important to take advantage of the initial review of documentation that you're doing before you submit this to the MAC, and it becomes a part of the administrative record. You want to also check whether the claims are coded, billed, and paid correctly. We think so much about documentation being the patient's narrative, but we also want to make sure that the back end affecting payment is also reviewed. Next slide. So what is a post-payment review? A post-payment audit occurs after a provider has submitted a claim to receive payments. Basically, they're looking at claims that have already been paid. To the extent there are any issues determined, for example, eligibility requirements weren't met or the claim isn't supported, they would then ask for that money back through a demand letter. There are a lot of different sources for post-payment review. Really common, we're seeing data mining. And of course, contractors can basically look at the data however they want, which makes it easier for providers to get selected for that post-payment review. Some of the things they might see when they're looking at that information: are you billing more than your peers? Did you have a change in your reimbursement last year to this year? There's so many different ways they can look at it, and it's really one of the big reasons that providers get targeted for post-payment review. There are also, you can be placed on post-payment review because of complaints or referrals. When you get a post-pay review notice, one of the first things we do in our firm is we file a Freedom of Information Act request. We want to know what's going on. Where did the source come from? Was it a referral? Was it a complaint? Or, was it the more common reason? Was it a data mining source? It takes a long time to get that information back, but eventually we do get it, and it can be very, very helpful in narrowing or identifying what the scope of the review is. Sometimes we get some very specific details from the contractor's investigative file, which can be extremely helpful. Next slide. There are several big concerns with post-payment reviews. The money's already been paid and used for overhead and salaries, and now they're asking to get that money back. Getting the money together when it's demanded from the provider can be very difficult. Post-payment audits are sometimes extrapolated. When these demands are extrapolated, you may be talking about a lot more than just the sample of claims that's been submitted. We see too often several thousands of dollars quickly becoming hundreds of thousands of dollars when these claims are extrapolated over a larger period of time. There are also oftentimes lots of errors identified per claim. So when you go through the appeals process, you might be able to win the face-to-face issue, but then you still have to prove the medical necessity denial. The more denials you have, the harder it is to win them because you're trying to defend multiple aspects of the claim. Medicare can deny your claim for any number of reasons. In order for you to get paid, you have to win on every single denial that they bring to the table. Next slide. So this is just a quick snapshot of some of the CMS appeal statistics. It's always important to look at these. One of the main points is it's better to get this all sorted out in the medical review process. Respond with great documentation and get your claim paid, because going through the appeals process is long and time consuming, and also you might not win. If you look at 2012 and then you look at 2020, those numbers have dropped dramatically for fully favorable and partially favorable. You don't want to get into the appeals process. It is incredibly long. You have multiple levels of review, and each of those takes months to complete. Next slide. What is a suspension? So suspensions are terrible. Your revenue stops, and it's going to stop very likely for a full 180 days. Sometimes suspensions are extended when the contractor hasn't completed their investigation, and that can double the length of the suspension to a whole year. You might be getting paid for claims, but the money's held in escrow until that investigation is completed. So even though claims are going through, you're not getting any of the funds. When your payer mix is heavily Medicare, this is a huge amount of your reimbursement and can be debilitating if you're not, and it can be debilitating if you're not getting paid. On top of that, there's no formal appeals process. You do get an opportunity to file a rebuttal within 15 days, which is taken into consideration by CMS, and they will probably issue you a response. However, very, very rarely, almost never, will they remove you from suspension. There's several different reasons that a provider can be placed on suspension. One of the most common that we see is credible allegation of fraud. Next slide. So what is a credible allegation of fraud? Unfortunately for providers, the barrier to establish this for CMS is extremely low. It could be based on a probe audit. They'll tell you that they got the medical review and the review results weren't good. It could be a hotline complaint, more of the data mining. It could be from a law enforcement investigation. So when you receive your suspension, they're generally going to generically reference 5 claims and say the documentation didn't support the services were medically necessary. This can be a credible allegation of fraud, and you are suspended for 180 days. They don't have to tell you anything about their actual analysis or how they applied the Medicare coverage criteria. In your rebuttal, you could take that opportunity to respond to those 5 claims that they did identify. But again, we often see that the investigation that's occurring during the suspension period is going to take the full 180 days. In terms of knowing whether you're suspended, you're going to get a notice letter, but they usually send it on the day of or the day before the suspension actually occurs. So you don't really have notice. Basically, on June 27th, today, they issue the letter, and on June 28th, tomorrow, you receive the letter and find out that you were suspended the day before. Next slide. So as I mentioned, after receiving notice of a suspension, you do have the opportunity to submit a rebuttal. We always recommend it, even though it doesn't often result in the reversal of the suspension, because it's a part of your defense. They're giving you some of the allegations, even though those are generic and they're only related to those 5 claims. It is your opportunity to respond to them to collect and submit additional documentation. Sometimes they say we interviewed beneficiaries and they told us they didn't receive the services. You could potentially go back and ask those beneficiaries to sign affidavits. If they agree that they received the services, you can do things to begin to develop your defense. When they finally release you from suspension and you go through the appeals process, you have the best documentation you can and you're ready to support those services. Next slide. Some conclusions here. The potential results of a bad audit: increased likelihood of post-payment review, overpayments, repayments, cash flow shortages, could lead to suspension of your Medicare payments. We know how difficult that can be. And then also it could lead to revocation, which is an entirely different administrative process that take an entire hour to discuss. The things you can do to minimize impact of these types of audit and suspension mechanisms is to start compliance now. If your practice receives any kind of notice, TPE, prepayment, post-payment review, or suspension, get legal counsel involved immediately. The sooner you do, the sooner that providers get back to business as normal. You really need someone that knows these processes and knows what it takes to go through the audits or the suspension as fast as possible. More than anything else, never ignore a notice from Medicare. It won't go away, and it's a basis for them to escalate to more severe administrative actions later on. Next slide. We want to thank you guys for having us today, and we're happy to address any questions that may have come up.
As for now, we don't have any questions. So I think we're just going to close it.
Thank you so much to our presenters, Meaghan and Christin, for that information. And thank you to our attendees and Dr. Hebert for joining us today. I will be sending a copy of the PowerPoint slides tomorrow. And if you have any further questions, reach out to them, and have an amazing Tuesday.
Thanks, Meaghan and Christin, and thanks to the support team at Liles Parker. We appreciate the partnership. Have a great day.
Thank you.
You too.
Thanks, you too.